Assalamualaikum warahmatullahi wabarakatuh. I'm Ifah Haziq bin Muhammad Rizwan. My ID number is U2420025. I'm from Group 8, Group Dr. Stone. Today, I'm going to present about drug management in respiratory. In this first slide, we show that this is a prescription about respiratory disease, asthma. Introduction. Asthma is a chronic respiratory condition that affects the airway in the lung. It causes inflammation and narrowing of the airway, making it difficult to breathe. This condition can affect individuals from all ages, from the young ones and to the oldest. I'm going to give you these 4 key points about the symptoms of asthma. Firstly is whistling. A whistling sound when breathing, especially during exhalation. Second, shortness of breath. It's a feeling as thought you cannot get enough of air. Third, coughing, particularly at night or early in the morning, which can be persistent and sometimes produce mucus. Lastly, chest tightness is a sensation of a pressure or tightness in the chest. That's all from the introduction. Thank you.
Hi, my name is Shami. So we're gonna talk about drug discussion. So the first drugs that we use for the prescription is Relva Ellipta. So the drug profile for this drug is generic name. The generic name is fluticasone, furet, and vilanterol. The dosage form for this drug is inhalation powder in a portable inhaler device. So the usual dosage for this drug is 92 per 22 mg for COPD and asthma, and 184 per 22 mg for asthma only. So the indication for this drug is a regular treatment for adult and adolescent aged 12 years above who are not adequately controlled with inhaled corticosteroid and as needed. Inhaled short-acting beta agonist 2. The classification for this drug is Relva Ellipta is classified as a combination inhaler containing 2 active ingredients, which is the first ingredient is fluticasone furet, works by inhaled corticosteroid, and vilanterol triphenate, which is work as a long-acting beta-2 adrenergic agonist. So the mechanism of action for this drug is fluticasone furet is a corticosteroid that reduces inflammation in the airways, while vilanterol is a long-acting beta-2 agonist that relaxes and widens the airways. So let's go to the next drug. Alright, so the next drug is prednisolone YSP tablet. So the generic name for this drug is prednisolone YSP. The dosage form for these drugs is tablet 5 mg and syrup 3 mg per 5 ml. The usual dosage, actually this drug doesn't have a usual dosage. The dosage varies depending on the condition being treated. So the indication for this drug, prednisolone YSP is used to treat conditions such as bronchial asthma, allergic disease, rheumatoid arthritis, juvenile rheumatoid arthritis, rheumatic myocarditis, acute and chronic gout. The classification for these drugs is prednisolone YSP is classified as a glucocorticoid. It falls under the category of corticosteroid hormone used for their anti-inflammatory and immunosuppressant properties. The mechanism of action for this drug, prednisolone, is a glucocorticoid with primarily anti-inflammatory, and immunosuppressant properties. It reduces the inflammation for patient.
Hello, my name is Pangeran, matrix number U4240051. In this slide, I will be talking about the study case of an asthma patient, which is Muhammad Haziq Shami 23 years old, male. He's been complaining about the tightness of his chest, difficulty of breathing, and wheezing. And through thoroughly investigation, he has a known disease of asthma since childhood, but he recently experienced an asthma attack after exposure to cold air. His condition is not fatal but may have a difficulty in maintaining a healthy lifestyle. And he has sent us a video of his daily life routine after exposure to cold air. As you can see here, he's using an inhaler for an immediate pain relief from exposuring to the cold air. And we have given him a treatment plan which is immediate management, long-term management, and a follow-up for every 2 weeks to assess the situation. The immediate management for patient Shami is Relva inhaler taken 1 puff every day for 30 days. Prednisolone tablet every day intake for 30 days to avoid the asthma attacks. And for the long-term management, we will be advising him to change his lifestyle to avoid the triggers from asthma attack, having to wear masks, having to avoid cold air, avoid smoking or vaping to cause the asthma worsen. And that is all for me and for study case in asthma attack.
So, Assalamualaikum and very good morning to Madam Rashida. So, as you guys can see, asthma is a chronic respiratory condition that affects millions of individuals globally. While there is no cure for asthma, effective management and treatment strategies can significantly improve the quality of life for those affected. So, the key point to remember is the first one is understanding triggers. It means identifying and avoiding asthma triggers is crucial for preventing exacerbation. Number two is medication adherence, which is regular use of prescribed medications such as inhale and other than that is essential for controlling symptoms and preventing attack. Number three is monitoring, which is regular monitoring of lung function and symptom help in adjusting treatment plan as needed. Number four is emergency plan, which is having an action plan for asthma attacks, including recognizing symptom and knowing when to seek emergency care is vital. And the last one is lifestyle adjustment, incorporating healthy lifestyle change such as avoiding smoking and maintaining a healthy weight can contribute to better asthma control.
Now I'm going to talk about drug management in gastrointestinal disease. This first slide, we show that the prescription about gastrointestinal disease, known as GERD. Introduction. Gastroesophageal reflux disease, known as GERD, is a chronic digestive disorder that occurs when stomach acid or bile flow back into the esophagus, irritating its lining. This reflux happens when the lower esophageal sphincter, we know as LES, is a muscle ring between the esophagus and the stomach is weak. Now, I'm going to talk about these four symptoms of GERD. First is heartburn, a burning sensation in the chest, usually after eating or eating at night. Second is hoarseness or sore, in the throat. It's a irritation and inflammation in our throat. Third is chest pain. It's a discomfort or pain that can be mistaken for a heart-related issue but is due to acid reflux. Lastly, nausea. Sometimes accompanied by vomiting. That is from introduction. Thank you.
Alright, back again with me, Shami. So the drug discussion for this disease, GIT good, is esomeprazole. So the generic name for this drug is esomeprazole. The dosage form for this drug usually oral tablet, oral powder for constitution, and intravenous injection. The usual dose for this drug actually like 20 mg and 40 mg for the tablet, 10 mg, 20 mg and 40 mg for oral powder, and 20 mg, 40 mg and 80 mg for intravenous injection. The indication for this drug, actually this drug used for treatment of gastroesophageal reflux disease, which is good. It's healing of erosive esophagitis, maintaining the healing of erosive esophagitis, the treatment of Zollinger-Ellison syndrome, and eradication of Helicobacter pylori. The classification for this drug is classified as a proton pump inhibitor (PPI). It falls under the category of gastrointestinal agent used for reducing gastric acid production. The mechanism for these drugs is its mechanism of action involves blocking the final step in the gastric acid secretion by specifically inhibiting the H plus K plus ATPase enzyme system present on the secretory surface of the gastric parietal cell. So next drugs for GERD is Gaviscon double action. The generic name for this drug is sodium alginate, sodium barbicarbonate, and calcium carbonate. The dosage form for this drug is chewable tablet and oral suspension. The usual dose is 250 mg sodium alginate, 106.5 mg sodium bicarbonate, and 187.5 mg calcium carbonate. The indication for this drug, it used to treat symptoms of gastroesophageal reflux disease, GERD, such as acid regurgitation, heartburn, and indigestion. It also used for symptoms of excess stomach acid. This drug classified as a anti-acid, anti-reflux agent, and anti-ulcerant. It used to relieve symptoms as gastroesophageal reflux disease, such as heartburn and acid indigestion. Mechanism of action for this drug, Gaviscon double action works through a combination of antacid, calcium carbonate, and sodium bicarbonate, and alginate sodium alginate. Alright, that's all for the drugs discussion.
Hello, my name is Pangeran, and in this slide, I will be talking about a study case of a gut patient named Irfan Daniel, age 21, and his gender is male. He has complained persistent heartburn and a sour taste in the mouth after a meal. Through our investigation, Irfan has a history of occasionally getting heartburn, but his symptoms have been worsened as months go by. He also reports having fatty food, and caffeine makes the pain stronger. And so for our treatment plan for Irfan Daniel is having his lifestyle modification avoiding trigger food such as spicy food, high sugar, and high cholesterol food. By doing this, he is more likely to not be getting heartburn more frequently. And through pharmacomanagement is we will be giving him medication, which is Gaviscon double action, taken 4 times a day for 10 days. Also, esomeprazole, taken 2 times a day for 30 days, ensuring to lower stomach acid. Yes, and we will be doing this with a follow-up every 4 to 6 weeks to ensure the patient is safe and making further changes if there are unknown effects. And that is all for Irfan Daniel study case and his treatment plan.
Conclusion for GERD. GERD is stand for gastroesophageal reflux disease. So as you guys can see, it's common and chronic condition that significantly impact patient quality of life. Through understanding the pathophysiology, recognizing the symptom, and implementing effective management strategies, patient can experience relief and prevent complication. So the key you must remember is number one is identification of symptoms, which is early recognition of typically symptoms such as heartburn and any typical symptom like chest pain and cough is crucial. Number two is lifestyle modification, which is it means adopting lifestyle change such as weight loss, dietary adjustment, and elevating the heat of the bed can significantly reduce GERD symptoms. Number three is pharmacological treatment. It means medication like proton pump inhibitors, receptor antagonists, and anticides play a vital role in managing and controlling the symptom. So number four is surgical option, which is for patient with severe symptom or those unresponsive to medication. Surgical intervention such as fundoplication may be considered. And the last one, as you guys can see, long-term management. So what is long-term management? Long-term management is regular follow-up with healthcare provider to monitor and adjust treatment plans is essential for effective long-term management. So that's all for conclusion of disease asthma and good. So that's all from me. Thank you very much.